So today's lab has to do with point-of-care testing in chemistry analysis, and it's going to be a whole blood glucose or fingerstick glucose test. So to perform this test, we're going to be using a handheld device for glucose testing on fingerstick whole blood, and we are using the Bayer contour meter. So the contour meter is something that a diabetic patient might have in their home in order to monitor their glucose levels, but in the hospital setting and other healthcare facilities, it is also used by nurses and other staff members to monitor the blood sugar levels of patients as well. So just like with any lab test, we're going to have to perform some control testing on control materials to ensure that our equipment or our machine is actually going to be accurately measuring the glucose level. And contour controls have a low level, which would be lower than the normal range for an adult person. They have a normal level, which is roughly the same as a normal glucose level in a person, and they have a high level, which would be reading the higher levels, just to make sure that we are accurately reading the levels that might be found for a diabetic patient. So whenever we're going to be measuring glucose using our contour meter, the last piece of equipment we need are the reading strips. So the contour reading strips come in a tube of 50, and whenever we use these strips, we're going to be taking them out one at a time, and you have to be sure not to touch the small area at the top that looks like a gray microchip. And the reason for that is because that's the area that's going to actually perform the reading inside of the meter. And you see, as I stick the strip into the meter, it's going to be activating the meter, and then the meter is asking me for a drop of sample. So the sample is inserted into the strip automatically through something called capillary action or SIP sampling. And it's going to pull in exactly 6.6 microliters, so less than 1 microliter of sample to perform a reading. We are going to start with the low level of contour glucose meter control. And after the strip fills, it takes 5 seconds to perform the reading. And we got a reading of 43 milligrams per deciliter. For the low-level control, it states in our control sample that the range or expected value that we should get should be between 35 and 49 milligrams per deciliter. We always have to repeat or perform the next test with a new strip, so a new strip has to be inserted. And now we're going to do the normal level control. Again, it'll take 5 seconds to get a reading. 141 milligrams per deciliter. The range for normal control is 110 to 152. So again, we're within our expected range. Lastly, we'll do the high level control. 427 milligrams per deciliter. The normal range for this control is 318 to 439. Lastly, I'm going to show you how to perform this test on an actual patient's fingerstick whole blood sample. So we do need to follow the proper procedure for fingerstick sample collection of whole blood. If you haven't watched that video, please watch it before completing this video for glucose testing. So using our lancet on an alcohol cleaned finger, we're going to wipe away the first drop. Again, we wipe away the first drop because during the puncturing of the skin, other fluids are released from the cells in the area, and we don't want those to affect our glucose reading on the blood itself. Take the second sample of blood from the second drop, and in 5 seconds, we have a reading of 86 milligrams per deciliter. In class, we learn that the serum or plasma normal range or reference range for glucose levels is going to be 70 to 99 milligrams per deciliter. However, when we have a whole blood sample, that normal range is a bit lower. Please look through your notes and use that lower range for whole blood samples to complete your assignment for this lab on whole blood glucose testing using the contour meter.